Health Minister who last negotiated with premiers over major healthcare reforms was Jane Philpott. She introduced a 10-year funding deal and waited for the provinces to sign on, and they all did. After resigning the cabinet over the SNC-Lavalin scandal and being subsequently kicked out of the Liberal caucus, Jane Philpott is now running as an independent candidate in Markham-Stouffville, and she joins us from Toronto. All right, Jane, the Liberals promised, I guess it works out to about $1.2 billion a year over their next mandate to provide doctors on demand for every Canadian and access to mental health and pharmacare. Is this a realistic promise in your view? Given the parliamentary budget officer, I think he's estimated at a $20 billion price tag to implement just the pharmacare.
Well, thank you very much for those questions, Don. And these aspirations are laudable. Obviously, the things that Canadians are asking for when it comes to health care are the issues like pharmacare, mental health care, home care, and access to primary care, family doctors. So the goals are the right ones. I think the concern about this morning's announcement is the ambiguity that's associated with it. There are no timelines in terms of implementation. We don't want 4 years of negotiations to take place. We want implementation, and people need to know, in fact, is pharmacare going to be implemented or not? And as you've also pointed out, there's a real concern around the dollar figure attached to this, $6 billion over 4 years. Sounds like a very large number, but these are big, expensive items. They are good value for money if the money is invested properly, but they certainly fall short of what both the Hoskins report recommended and what the parliamentary budget officer has recommended.
Yeah, I mean, your ambiguity point's well noted here, because Trudeau's promised to, I think the quote out of the press release is, ensure every Canadian can find a family doctor or a primary care team. My goodness, that's the nirvana of healthcare delivery promises. How the heck do you do it under a $6 billion envelope when you're paying most of that for pharmacare?
Exactly. And as you say, it is the right thing to do. Every Canadian should have access to a family doctor and a primary health care team. That is the best way to get good value for money in health care. And the federal government, I believe, does have a role in those areas, but there is absolute vagueness on how this is going to be done. Are they going to introduce a piece of legislation that is going to require that the provinces deliver on these various areas like mental health care, home care, pharmacare, and primary care? When are they going to do that? What is the mechanism associated with it? And as I say, specifically around pharmacare, we have a fantastic report that Hoskins and his team came out with just a few months ago. And voters have a right to know, if they vote for Liberals, are they going to have a national, single-payer, universal public pharmacare system or not?
So do you feel that this promise just kicks the can down the road into another mandate after this one?
Well, certainly that would be the anxiety that that voters should feel, and I hope that as they are talking to candidates that they will ask for some specificity on this. We've been studying this for decades now. There is a huge appetite amongst Canadians to have universal public single-payer pharmacare. It's been well proven to be the right thing to do, but the announcement from this morning falls short of the specifics that are necessary to know that if you vote for a Liberal government, that's what you'll get.
One thing you had to do on your accord was sit down with the health ministers right across the country and get them to sign on to a funding deal some of them thought wasn't enough, yet you had Trudeau bashing Conservative premiers on multiple fronts today and saying, well, I'm going to negotiate with them. Is that a recipe for a successful outcome, or does honey work better than vinegar?
Well, we, as elected officials, need to have collaborative relationships across all orders of government to be able to do the best for Canadian people. And you're right that federal, provincial, territorial negotiations are challenging at the best of times. I think that, again, requires some more specifics on what does this look like. The Hoskins report refers, for example, to the possibility of a Pharmacare Act. We know that the Canada Health Act has proven itself over the last 35 years to be an effective tool in order to ensure ensure that when there are transfers of upwards of $40 billion a year that go to provinces, that there is a requirement in return that there will be universal access to physician care and hospital care. So is the mechanism for working with provinces and territories to introduce a similar piece of legislation and or to amend the Canada Health Act? Those are the specifics that Canadians should be asking their candidates about as to what they're going to get if they vote for a specific party, and they should ask all parties those questions.
Very quickly, you're in a key battleground riding, Liberal one until you're now running as an independent. Is this blackface, brownface controversy coming up on the doorstep much, or is it kind of something that Canadians are looking at beyond?
Well, I would say a couple of things that do come up at the doorstep is that people want us to talk about racial discrimination and all forms of systemic discrimination. And so I think that is an important conversation that has been raised over this. And there's much more that can be done to address these, the very real systemic forms of racism in our country. The other thing that comes up at the doors is that people want authenticity. They want to know that they are getting the politicians that they're voting for, and that we will be honest and truthful with them at all times.
Okay. Jane Philpott, pleasure having you on. Thank you.
Thanks for having me.